Alright, here's my family. They're going to be my audience for my presentation tonight. It's my dad, my little sister, and my brother. My brother's going to hold the camera. Hi, my name is Maralynn, and we must all agree that visiting the dental office is not one of our favorite things to do. Let's face it, we usually don't wake up in the morning excited to visit the dental office because of a regular routine cleaning or a toothache. Why is this? Why don't we enjoy the dental office? Well, I'm a dental assistant, and I see patients walk in and out of the office daily. I see different stories. I see why patients don't enjoy the dental office. And I was curious, what makes people not want to visit the dentist office? Oral health is very important to the body. It not only affects your mouth and your oral health, but also your whole overall health as well. Like I said, I witness daily patients come in and out of the dentist office. This could be from a simple cleaning to assisting with implants. There are many procedures. You'd think that patients would want to get their mouth taken care of, but why don't they do this? I'm going to use an example of a man that I met the other day at the dentist office. The other day, and a man came in the office with a very extreme toothache on his upper left. It was his last molar, and he didn't know what was going on. He only felt the excruciating pain and just wanted the pain to go away. He took a seat in the dentist chair, and the dentist began talking to him. We took an x-ray to see what was going on, and he had a severe infection in that tooth. He needed a root canal in that tooth, and he eventually needed a crown in that tooth. It came around to $3,000, and the man needed to be presenting that money that day of the appointment. The man was very disappointed, and he left the office that day. He only got the tooth extracted. He didn't even want to save the tooth because he couldn't afford it financially. So many of these stories happen daily. I see patients come in the office, need to have some dental work done, and they just can't afford it, so they either leave or get the extreme taken care of, which could be extracting a tooth or getting dentures. The best option is to save all of your teeth, and how can we help our patients save these teeth? We need to look at each patient as an individual. There are different options for every single patient. Before I go through the different options that a patient can go through, I'm going to show you a chart that I made up. I had a survey done. 2 other assistants helped me as well, and I surveyed 100 patients to see how or why, they didn't want to visit the dentist office. So I'm going to show you a survey right here. The main reason why patients did not want to come to the dentist office was because of costs. Patients do not want to deal with the finances up front. They can't afford it, so they just would either leave the dentist office or decide to never come back again. The second option was treatment. They didn't understand the treatment that the dentist was proposing to them. And then third was because of being uncomfortable or because of pain. They don't like the sound of the drill, or they don't like the pain of the needle, etc. And then fourth was busy lifestyles. Patients just don't have the time to come to the dentist office. So out of those 4 main reasons, the cost was number 1. Patients don't want to deal with the finances. And the second reason why patients avoid the dentist office is because of the excessive treatment that they just can't get taken care of. A lot of the treatment is confusing to a patient. So number 1, we're going to go over why patients avoid the dentist office because of cost. Patients need to be presented different treatment or different financial plans they can go through. If a patient can't come up with the money up front, they should be offered a certain financial plan. Perhaps the patient could come up with a down payment and commit to a certain payment each month. It's not so overwhelming to the patient, and it seems more realistic. And then second was the treatment options. What can a patient get done for a tooth? If a tooth is in pain, how can that patient treat that tooth instead of pulling it? We need to figure out these different options. I also have another picture of a tooth. Usually, when a tooth needs treatment, it starts out with having decay form on the tooth. And I'm going to show you this tooth right here. I'm going to have my brother hold this up for you. And you'll be able to see the tooth. You could see the old filling. Perhaps decay is starting on the tooth. You need to put a filling. Here is a filling, for example. And how decay forms is a decay is formed when teeth are not properly cleaned. The process of decay begins when acid attacks the enamel. It makes it porous and then dissolves into the tooth. the decay can go deeper and deeper. If the decay hits this nerve, you need a root canal. First of all, if the decay is shallow enough, if it's on the surface of the tooth, a decay needs to be replaced. It needs to be taken out and replaced with a filling. The filling can cost from $115 to $195 depending on how the filling is, how big the filling is. And then if the decay goes deeper and deeper into the nerve, which is right here, you need a root canal. And this is showing that this is the root of the tooth and the canal of the tooth. And that's what a root canal consists of, is cleaning out the roots. A root canal can vary from $1,000 to $1,800. And then you would need a crown after a root canal placed on the tooth, which could vary from $850 to $950. This is all very costly procedures. That is how you can fix a tooth. If a tooth can be replaced by a filling or a root canal, it still is very expensive. So the patient needs to be presented financial plans, like I said before. They need to be presented with every option. Also, if a tooth cannot be saved, however, if the decay goes too deep into the nerve, the tooth will need to be extracted. How can we replace this tooth? I have a picture of a bridge. There's different ways you can replace a tooth. The two options are a bridge. Here's a bridge right here. This is a bridge. It hugs the two teeth around it, hug the two surrounding teeth, and then a tooth is placed in the middle, just like so. And then the best option to replace a tooth is a tooth implant. It is the closest to a real tooth. You put an implant into the bone. This is the bone of the tooth right here. And then you put a crown on top, so it's the same as a regular tooth, almost identical. However, implants can cost around $3,500. Bridges can cost around $2,500. All costly procedures that need to be looked into. A patient needs to understand the different options. If a patient wants implants, he needs to understand the full price. You should be able to discuss every option with the patient. There are also removables or partials, something that comes in and out of the mouth. And those range around $1,000 to $1,200, and those can be used for multiple teeth. So those are all the different options for replacing teeth. A patient needs to be presented with all these options. A patient needs to be presented with a certain financial plan, so it's easy for him to go through all these procedures. However, it might not be easy. It'll make the process easier instead of presenting a patient with the most expensive dental treatment, expecting him to pay that up front. So by sharing all this with the patient will feel like he understands what's going on more. And when the patient understands what's going on, he'll feel cared for more. I knew a doctor, his name was Dr. Wallace, and he stated that he tried to make an effort to know every single patient individually and understand every patient's treatment needs and financial needs. What does that patient need? We need to understand what the patient needs and take care of our patients. Overall, I believe that there needs to be some kind of outline for a financial plan and a treatment plan for every individual patient. The goal is to help the patient. The entire dental staff needs to focus on communicating this with the patient. By caring more about the patient and not appearing as money-oriented, the patients will feel much more cared for. Many people will present in the dental office, the staff will say, well, what if we lose business? By us caring more for our patients, the patients will return for business. Therefore, giving the office more money, the patients feel cared for, and it's a win-win situation. I know a quote by Napoleon Hill, and he stated, if your imagination leads you to understand how quickly people grant your requests, when those requests appeal to their self-interest, you can have practically anything you go after. So as we all work together, in the end, both the patients and the dental practice will win.